Now, turning over to our Finding Hope series, we're focusing on addiction and mental health here in Idaho, seeking ways to improve access, reduce stigma, and start a conversation. When you seek help from a social worker, maybe a counselor, or even a therapist, you get a trustworthy professional who's ready to hear the worst. But listening to those stories every day can be a challenge. So I went to the Nampa Family Justice Center to find out how they cope in today's Finding Hope.
Not everybody can do this work, but everybody can support people that are doing this work.
Employees at the Nampa Family Justice Center hear details about horrific traumas regularly. The constant exposure to all the trauma poses a serious threat to their mental and emotional well-being.
Vicarious trauma is when you hear the story over and over and over again, many stories and tragic stories, you start taking on that trauma.
Due to the nature of the industry, people like employees and allies of the Nampa Family Justice Center are more susceptible to experiencing vicarious trauma.
So as a worker, you take on the trauma of other people. So you can start feeling depressed, and you can start feeling withdrawal and isolation and sad and grief and all those things.
And for one employee, she's well aware of the tolls this profession can take on a person.
In the helping field, it's easy to get burned out. Because you're constantly hearing these traumatic stories.
To prevent any burnouts, every 6 weeks the center arranges self-care meetings for all employees. The meetings include psychoeducation training to guide self-assessments of each employee's mental and emotional well-being. They also provide lighthearted activities and team building opportunities when possible.
There's an atmosphere of support, and I think it comes from the top down.
Well, it's encouraged to seek help when you need, but for those at the Nampa Family Justice Center, they're really committed to expanding the help for their counselors and their advocates. So they're working to expand a wellness center in their building after purchasing additional space. Right now, they're currently working towards raising funds to renovate the wellness room for the counselors, social workers, and advocates to use after working with clients.